afternoon. My name is Nancy Joyce, and I'm here again today for my midterm presentation in pharmacology for Mrs. House at Ogeechee Tech in Statesboro. I am doing a presentation today on amoxicillin, and I chose this drug because I procrastinated and my first drug was chosen, so I just pulled amoxicillin out of a hat, and I'm going to make the best of it. It's actually a pretty interesting drug. I would consider it to be more of a workhorse drug. It treats a wide variety of stuff. So if you look at my PowerPoint, the amoxicillin is in the penicillin-ampicillin family, and it has improved duration over ampicillin. And it's a synthetic drug, which means that it's made naturally from occurring substances. And it differs structurally from ampicillin because it has an additional hydroxyl group on the benzene ring. If you go to the next slide, amoxicillin was first discovered by researchers in the UK by Beecham Research Laboratories in 1972. In the US, the affiliated company is GlaxoSmithKline, and they market it under the trade name for Amoxil. Again, the brand name is Amoxil and Trimox, and the generic is amoxicillin. And because there is a long established track record in scientific studies on amoxicillin, they've had over 40 years to do scientific studies on it, and it's been extensively researched in treating a wide variety of ailments. The route of administration, you take this orally, and it comes in tablets and oral suspension of various strengths. The only caution to this is because it's excreted through the urinary tract in young kids, like younger than 3 months old, that may not have a fully developed urinary system, then you want to be cautious with the dose that you give them, and with older adults that may have some renal failure or their renal system isn't working at 100%, then you may want to alter the dose for that too. The absorption of amoxicillin, it's very stable, and it's gastric acid doesn't affect the absorption. You can take it with or without food. There's no precautions on food or drinks to take it with, and it's better absorbed than penicillin and ampicillin, and it provides higher, more sustained blood antibiotic levels. It penetrates the tissue very well and diffuses readily into most bodily tissues and fluids, with the exception of the brain and spinal fluid. The half-life of this medication is 61.3 minutes, but in the absence of renal failure, it's more like in the absence of renal function, it's 7 to 10 hours. It may be longer in neonatal and the elderly because of the renal function. In general, it takes 5 or 6 hours for amoxicillin to leave the system. Amoxicillin is a moderate spectrum antibiotic. It's active against a wide range of gram-positive and a smaller range of gram-negative organisms, and it's approved by the FDA on the following conditions that are listed on the slide. A lot of upper respiratory infections it treats, as well as urinary tract, skin infections, gonorrhea, and I found it interesting the off-label or investigational uses of the drug for chlamydial infections, post-exposure for anthrax. You can take it prophylactically for heart valve infections, if you're going to be having surgery, endocarditis, typhoid fever, it helps with that, and with Lyme disease. It appears to be safe for anyone. There's no precautions other than the young, the neonatal, and the elderly because of the renal function. It's safe for children, it's safe for pregnant women, and the side effect is mainly going to be diarrhea, vomiting, nausea, and side effects that you want to look for would be allergic reaction type indications, rash, redness, itching, that would indicate an allergy to the drug, and there's no contraindications. There's no label warnings associated with amoxicillin, but if you are a woman on birth control pills, like a lot of antibiotics, you may become pregnant when you're taking amoxicillin because it reduces the efficacy of the drug, and you could end up getting pregnant, so you need to be cautious with your own birth control and taking amoxicillin. And another thing to consider is that amoxicillin is secreted through breast milk, so there is a possibility of a hypersensitivity in the baby, but it's not contraindicated. You can take it when you are breastfeeding. So some of the questions that I have are, what is the route of administration for amoxicillin? What is the half-life? Are there any foods that you should avoid when taking it? Name one condition or disease that amoxicillin is used to treat, and what is one of the brand names for amoxicillin? So some of the things that I learned about amoxicillin that I found interesting is that studies show that it is the third most prescribed drug behind Lipitor and hydrocodone, or Vicodin. Actually, Vicodin, it's the third most prescribed, and it is the most prescribed antibiotic. I thought of it being the little engine that could. It's a workhorse drug that treats anything from upper respiratory to urinary tract to wide range heart ailments, and it really is something that most people are going to come in contact with at some point in their life because it treats the different conditions and diseases that really plague the human race. So I found the drug to be interesting and enjoyed my research that I did on it, and that concludes my PowerPoint, and I hope that you have a nice day.